Hey, good morning, everyone. I'd like to call the Health and Human Services Committee hearing to order. Mr. Clerk, would you please call the roll?
Alderwoman Ingracia.
I'm sorry?
Present.
Alderwoman Tyus. Alderwoman Green. Alderwoman Martin.
Present.
Vice Chairwoman Navarro.
Present.
Alderwoman Middlebrook.
Present.
Alderwoman Rice.
Present.
Alderman Todd.
Present.
Chairwoman Spencer. Chairwoman Spencer. Oh, can't hear you.
Present. Can you hear me now?
Can hear you now, thank you. Alderwoman Tyus. We have 7 present. A quorum is present.
Thank you, Mr. Chair. I am having a difficulty with my microphone apparently here, so apologize. Thank you all for being here today. As you know, we're here to discuss the rollout of the COVID-19 vaccine, an issue that is incredibly important to the health and well-being of our city and our citizens. And we have all, I think, received some concerns about the distribution of the vaccine, and that is precisely why we called this hearing over the weekend following the start of the distribution here by the City of St. Louis. I want to thank you all for sharing your concerns with me over the course of the last week and taking them from our citizens. I am dismayed that here this morning, despite having confirmed with Dr. Echols that he would attend this morning, that he is not with us. It is certainly disappointing to all of us, especially considering I know we had a hearing yesterday, but there are many questions remaining unanswered. I shared with the committee this morning a letter I received yesterday from Cecilia Nadal, a resident of the City of St. Louis, and I'd like to take a moment just to read a few excerpts from it. I think it outlines a bit better than I could some of the concerns directly from somebody who's a resident in our city. You know, I think to set the stage here just a little bit, you know, Cecilia reached out to me. I think she's also reached out to several of you over the course of her service and residency here in the city, and was sharing her concerns that she had gathered from some of her neighbors and friends. Cecilia wrote it better than I could, so I'll just go ahead and read a little bit from her letter. She thanks the committee for inviting her to provide comments, and it states for the record that she is a 70-year-old woman, African-American and Latina with health factors. And she shares that she has a deep concern about the welfare and lives of our most vulnerable, including the communities of color that are senior citizens, African-Americans, Latinos, and those living in poverty, especially and those who have special needs. These communities are the most vulnerable to COVID-19 and have higher risk of death. This fact alone makes the delay by the state of Missouri in providing the city with vaccines egregious. The state knows that the city has the highest population of African-American population in Missouri, making their response to our needs shameful and wholly unacceptable. I'll skip a little bit here and go on to the city's response. On Saturday, January 30th, the African-American community did not get much hope if they watched television or read the St. Louis Post-Dispatch. The crowd that came to Union Station for the city's vaccine rollout was predominantly white, with many younger people. Senior citizens asked, "What are all those young people doing there?" One of our neighbors, who is white, received her shot that day and emailed the following. As to the character of the racial diversity, I would generalize it as virtually non-existent. During much of the waiting, I was preoccupied with the physical discomfort of being damp and overloaded with my coat, purse, and umbrella, but eventually I had a strong "what's wrong with this picture" feeling, and realized it was because I looked like kind of a hockey crowd. I don't remember seeing any young Black people. She goes on to describe the experience of other folks, and I think while it's important to recognize that the city of St. Louis, the state of Missouri, is doing something we have not been tasked with doing before. There's going to be hiccups in the road. I think we should all move through this recognizing that we cannot expect our city or our state to be perfect in the distribution of a vaccine. We all should recognize that on the front end, but it is our duty and our responsibility to our citizens as a whole, and specifically to the most vulnerable among us, to do everything in our power to distribute this vaccine in an equitable, fair, and transparent manner. And I thank you all for being here today to discuss some of the concerns that we have about achieving that, recognizing that we are going to make mistakes. There's no doubt about it, but we have got to be transparent and equitable in how we're communicating our plan and what it is that we plan to do. And with that, what I'd like to do, how I'd like to move through this, especially considering we do not have Dr. Echols or someone from the administration to answer these questions that are still remaining. I'd like the Vice Chair, Heather Navarro, to give us kind of an overview of what we learned yesterday in the hearing that did take place, so we can set the stage for what we already do know. And then I'd like to move into a discussion with the committee members where we can share our remaining questions and concerns that we're hearing from the community, and have ourselves as elected representatives of the city of St. Louis. And then we'll discuss the next steps for this committee to move forward to get answers that we need to share with our communities and service in the policy-oriented body of the Health and Human Services Policy Committee for the Board of Aldermen. So with that, I'll turn it over to Vice Chair Heather Navarro. Alderwoman Navarro, can you give us a little bit of an update of what we learned yesterday in the COVID-19 committee chaired by President Reed?
Yes, thank you, Chairwoman. And kind of what I've prepared are essentially some remarks summarizing a little bit of what we heard yesterday and some of the remaining questions. And I mean, this definitely doesn't encompass everything from yesterday, but it's all right. I'm just going to go ahead and share those here, and then we'll go follow up. And I have to say, I heard some similar kind of snapshots from Saturday's events from many of my constituents and others throughout the city as well. And so I went into yesterday's hearing very much looking for answers about how we are addressing an equitable, effective vaccine rollout. And I would say yesterday, Dr. Echols gave graciously of his time to the Coronavirus Special Committee, and we learned a bit about the vaccine event this past Saturday. And as with anything, it's important to evaluate what worked and what didn't, and plan accordingly for the next one. Our colleagues raised good questions about the public event on Saturday, such as why the primary form of notification was via email on a Friday night for an event on Saturday, and how we are tracking demographic information to know how well we are reaching vulnerable and traditionally marginalized communities. While many things went right last weekend, and the city should be proud that it was able to vaccinate around 4,500 people in 3 days, there are larger overarching questions that we would be negligent in our duties if we did not ask and if the city did not answer. Although neither Dr. Echols nor the mayor's office is here today, I think it's worth getting these questions on the record, and I look forward to hearing the responses. The city's commitment to equitable distribution is stated on the website, but knowing what we know about notice of and participation in last Saturday's mass vaccination event, what are the concrete steps the Department of Health is taking to prevent the perpetuation of deadly health disparities? What are the goals and objectives of an equitable vaccine rollout, and how are we measuring them? That is essentially what we need to know, what the community needs to know, and that is directly in response to Cecilia Nadal's questions and so many others. Transparency and accountability are keys to an equitable and just system. How is the Department of Health tracking data to ensure that the most vulnerable and traditionally marginalized have access to the vaccine? We heard a little bit yesterday about the Qualtrics system that the Department of Health uses, and that is being used as the sign-up system for people in St. Louis to receive notification. We learned that there are about 30,000 people on that list, and about 12,000 of those are people over the age of 65. At this point in time, it does not appear that we are necessarily ranking those in terms of order of vulnerability and prioritization. But why are we not doing that? We also learned that at the event on Saturday, folks could bring their paperwork if they signed up through the email system. But if they didn't have the paperwork, or if they were a walk-in, that they filled out paper forms, and that it will be some time before anyone's able to go through those paper forms and aggregate the data so that we know who was served at last weekend's event. So more specifically, I think we need to know what would it take to get electronic devices to the vaccination sites to track real-time data, and who is working on that, who is in charge of that task. What options do people have for transportation to the site? We heard that there were people who didn't know when they arrived if their disabilities would be accommodated, or if and when they received the notice on Friday evening, if they knew they were going to have young children with them on Saturday, could they bring children with them on Saturday? What options do people have for transportation? Besides email, what methods of communication are being used? What agreements do we have with local media outlets, radio and TV, to broadcast the next vaccination event? We don't have any specifics. Do we have phone bankers to call and recruit people to these events? Could these lists that the city has generated be used by hospitals when they have extra vaccine to administer? How can we set up mobile units and drive-through testing to reach more people, especially people with mobility and transit challenges? These have been proven successful elsewhere, and we have not heard a credible reason why the city is not looking to plan any such events. Last weekend's event was in a conference room at Union Station. What will it take to get a gymnasium or the convention center that will provide more room for people to spread out, wait in line indoors? We did hear that, I think the flow worked pretty well. Once people were inside the building, it seemed like they had a pretty good experience moving through the process. Yet when I heard that the event was being held at Union Station, my first thought was, great, we're going to use the Grand Hall or a ballroom. But there were roughly 14 stations inside a conference room. And so that means people were packed in there pretty tightly when there's ample space throughout our city right now to be available. So these are just some of the types of specifics that no one has answers for that we have heard. And without them, we are simply winging it, hoping that people will get the information and get to the vaccination site. Yes, there are challenges. Anybody who's planned an event knows that, and they take some planning, but with a little foresight, we can make sure that this vaccine reaches those most in need first. We have known since this virus hit that a vaccine would eventually be on its way. We have the Forsake of All report and the Racial Equities Indicator reports. We have the data to plot a strategy that reflects our goals and values with the vaccine and stops the needless death of more of our family members and neighbors. The vaccine is here and it is slowly being rolled out. This is not a surprise to anyone, and our community is watching us. We cannot use the excuse that we were caught off guard and that we're doing our best to scramble. Members of this committee and many organizations throughout St. Louis, including our medical hospitals and our universities, have offered their resources over the past year. And we owe it to our residents to put these resources to use for their benefit, and their lives depend on it. Hope is simply not a strategy. Luck is not a strategy. If we care about racial equity and an effective vaccine rollout, we need to be intentional. COVID-19 is the greatest challenge of our time, and it will be a travesty and our failure if our children and grandchildren struggle with the racial wounds inflicted by us today, in the same way our community wrestles now with the devastation of slavery, Jim Crow, and systemic racism. And with that, I look forward to seeing the plan that Dr. Echols said he would share with the Coronavirus Committee later this week. And I hope we can work collectively to ensure a safe, equitable, and effective rollout of the COVID vaccine. Thank you, Madam Chairwoman.
Thank you, Alderwoman Navarro. I think that really is a good kind of summary where we are. I realized here that we need to go through the committee and hear concerns. I think where I'd like to move us into, Alderwoman Navarro, is following your set of questions. I know you've prepared a good number of those, especially following the hearing yesterday. As we move through this next section, I'd like you all to I hopefully have some prepared questions, and we can share those collectively with the committee. I think it would be very helpful as we move through this discussion to keep it constructive. I appreciate your recognition of the things the city got right. There were several things the city did get right, starting to distribute the vaccine as soon as we got it, making sure that none of it was wasted, et cetera. And as we move through this, we are orienting our discussion here in constructive manner to improve the system for the better health outcomes of our community. As we collect these questions, concerns. I'd like to get that through today, as we pointed out, getting them on record, making sure that we have them collected in a written form to present to the doctor as he is collecting what he will be presenting to the full Board of Aldermen on Friday. So I just wanted to set that stage as we move through this for all the committee members to be collecting them in written form so we can very efficiently make sure that they get to the right place before the end of the day. I'd like to now move through the committee and hear some of the concerns and experiences that you all are having and can bring to the discussion. I'll do that in order of seniority. Alderwoman Ingracia.
Thank you, Madam Chairwoman. Wanted to thank Vice Chair Navarro as well. A number of us met yesterday to kind of go over what was still outstanding subsequent to the special COVID-19 committee. And I appreciate her putting those thoughts together and being so well spoken about it. I think most of my questions I'm still waiting on answers from in terms of what documentation will be coming forward from Dr. Echols, I believe on Friday. I do want to emphasize the fact that anyone that I've spoken to who has experience working with planning events similar to this or working with data on a regular basis indicates that we should be utilizing a scorecard that gives points to individuals who sign up via the survey, and those risk factors that people have should be given points. And then the folks that have the most points should be receiving, to the greatest of our ability, the vaccines first. And so I'm really interested to see what invitations went out on Friday, because it doesn't seem to me that there was any rhyme or reason to the individuals who received notifications. I am a little troubled that, you know, I'm not that tech savvy, but I know how to use an Excel spreadsheet. It seems to me like we should have already had that information in front of us on Tuesday. We could have had it today. I mean, as I said, I'm not tech savvy, but even I can manage to throw together an Excel filter in a matter of minutes. I appreciate that Alderman Navarro brought up racial equity and some of our, you know, really vulnerable, marginalized populations. We have so many plans before us that indicate that we keep doing this wrong over and over again. And I didn't seem to think that there was a plan at all to address this. Why are we not making phone calls to people? Why are we not having smaller mobile events at places that are easier to reach? Why are there not transportation plans? I mean, if I took care of my grandmother before she passed away. If somebody sent me an email on Friday night, I don't know if I could have had what I needed to get her to an appointment by Saturday morning, because she utilized a wheelchair and we didn't have an accessible vehicle. I mean, there's just so many things. The other thing I just wanted to bring up quickly, I don't know that it's been mentioned yet, but I would like to have some more information about what we do when we have people not show up or we have extra vaccine. It seems to me like maybe there should be a better plan than just sort of scrambling to grab bodies. I mean, I would definitely, in the absence of being able to contact people, not want to waste vaccines, but it seems like we could be addressing this a bit more meaningfully than grabbing, you know, people who are working at the aquarium to vaccinate them. And that's all I have right now. Thanks for allowing me to take some time.
Thank you, Alderwoman Ingracia. Alderwoman Tyus. You're on mute, Alderwoman Tyus.
Good morning, Madam Chairwoman and members of the committee. I'm sorry, I was a few seconds late. Why is Dr. Echols not here?
It was brought to my attention yesterday that Dr. Echols no longer planned to attend our hearing today.
So, me being the real person that's been here for a long time, my suggestion is all of us who are on this committee should gather with, how many people are on this committee? 10, 9, however many. We should go find our friends and we should get a subpoena and send to Dr. Echols. I am appalled that he doesn't appear before us he doesn't plan to appear. That is not acceptable. It's not acceptable because even though we carved out a COVID-19 committee, health encompasses all of this. And we already know when we look around, there's one male on this committee, and the rest of us are all, not that health is a punishment, but this is a punishment committee. And I resent it, not because right now health is very important, but for him not to appear. The questions I have, and I just had one, was for him. And I would lead the pack, because I don't mind if people are upset with me, in attempting to get in a subpoena and do a resolution and subpoena Dr. Echols to come before us. I thought you were very kind to acknowledge that he would only be here for a half an hour. I think that's a ridiculous amount of time. So I'm not going, I have a committee hearing every Wednesday at 10 o'clock, and I'm the chair of rules. And so we have a lot of stuff that everybody wants to get out. So I'm gonna have to get off, but I just want to put that out to the committee. This is totally disrespectful. When we look at this, when men don't want to hear about sexism, this is what sexism looks like to me. So the rest of you all, that's not your opinion, but to me, that's sexism, and I'm not going to participate in this. And I'm offended for you, even if you're not offended. Okay. Thank you very much.
Alderwoman Tyus, I appreciate your comments, and I appreciate your acknowledgement that we do have subpoena power. I do want to point out that we did, as a committee, arrange this hearing specifically to accommodate Dr. Echols' schedule, as was confirmed over the weekend on Sunday. I was grateful for his interaction with us as a committee at that time. Swift and immediate response to acknowledge that we do have outstanding questions, and this committee does have a duty and responsibility to the health and wellness of our community, our citizens, to ask those questions and share concerns when they're brought to us. And so it was with great dismay and great surprise to find out through the clerk that the director of our health department had decided to decline to come today. So I share your disappointment, Alderwoman, and your question that you have for him. I hope that you do choose to make it public, despite not having the subpoena power today. I do think it's important that we get those questions to him before he presents the plan on Friday, so that those can hopefully be addressed in that plan. And if not, we can continue to ask the questions that we need to have answered.
Well, Madam Chair, I will tell you that since the chief of staff and I got elected at the same time, so I actually talked to the mayor's office through Mr. Conway this past weekend. I called Madison because I was just dismayed when I saw what was going on. So I reached out, and they did reach out right back to me. So they know what my questions and concerns are. And I'm going to go ahead, and I am acting on my own to get my people, because my concern was what happens to the people who do not have email or do not have a method to sign up. So I've already started my own thing. I know my ward really well. So we're sending out our own mailing, and we're going to do it our own way so that we will have access, and we're setting up our own telephone banks. I cannot count on the mayor's office or the health department to look out for the zip code 63115 and 113. And 115 has been consistently one of the leaders, and they didn't test. And I started this back a year ago asking for a testing facility. So I can't count on them. So I am just going to put my own money. I'm running for office, but that's third. I'm going to put my own money, and I'm mailing out to the people that are 65 and older, and we're going to get them signed up if they don't have their own method of being able to get signed up. I've already had my form typed up. It's going out by the end of the week. And then if my secretary and I and others have to put them into the system or whatever, and we formed a phone tree bank to call people if we find out things. And I've already suggested to them that they should put the mobile we talked about getting the mammogram bus or other buses like that and putting them in quadrants and taking them into quadrants, because I'm concerned about a lot of seniors, Black or white, who do not have access to email, or even if they do, they don't know how to sign up online. That's something that's taken for granted for a lot of people, but a lot of older people just can't do that. So I've already made my questions and concerns known to the mayor's office, and I'm sure if they want to, they'll give them to Dr. Echols. But like I said, I have to get ready for my other meeting, and I also just don't want to participate when somebody can confirm that they're coming to a meeting in which you have oversight. I don't care who doesn't like that you call this meeting. You have oversight, and that is totally disrespectful. So, and I'm going to put it in writing to Dr. Echols about my concerns. And I already have other concerns about Dr. Echols, and you all already know it. And I should have continued what I was doing, because if I had done it, he wouldn't be sitting here right now. I was begged by the people from the mayor's group not to finish what I was doing, but I should have done it, especially when I see the total lack of respect and disregard when we're in the middle of a pandemic. That was the reason they said we should, Sharon, don't do that, don't do that. But he has a disregard for, we all represent a constituency and we have a right to ask him questions. Thank you very much, Madam Chair.
Thank you so much, Alderwoman Tyus. Alderwoman Green checked in with an excused absence today. Alderwoman Martin.
Thank you, Madam Chairwoman. And thank you for continuing to have this hearing today. I think it's important. I'm disappointed in that you scheduled this meeting and President Reed circumvented that and had his own. I'm also disappointed that Dr. Echols can't follow through on his commitment. If you weren't on the committee yesterday, you weren't allowed to ask questions. There was no public commentary or questions, so there's definitely a need for a follow-up hearing. I just want to kind of roll through my list of concerns. Most of it was addressed by Alderwoman Navarro, but I too have been contacted by several constituents about Saturday's event. I understand that the federal and state rollouts of the vaccine have been disastrous. I understand that Missouri's 50th. I understand that the city of St. Louis is not in the best of circumstances just because of how the state is handling this. But that said, we do have control over the populations that we contact and how we are not doing the best that we can do as far as I'm concerned. The disabled population in the city, elderly or otherwise, it seems to be no plan there. We watch on the news that other cities, well, even the state, they're doing drive-through vaccinations. I don't understand why that's not being considered, and why we are not partnering with groups that are organizations like the Urban League was suggested. They do drive-through events all the time. They partner with agencies. They have the infrastructure. I do not understand why we are not using someone or an agency already set up to handle mass crowds and lines and everything that Urban League has already been doing with meals and other supplies, why we did not call them first, why we are just renting rooms from Union Station. It makes no sense to me whatsoever. And again, just using my husband's grandparents as an example, there's no way that they could have even dropped off, maybe even using a wheelchair. I'm just not sure that Saturday was possible. I'm also concerned that, like Alderwoman Tyus said and other folks, people do not have access to email. We have got to figure out a better way. I mean, the state has a system where people are enrolled on a list in case of disaster that first responders can get in touch with them. I think Alderwoman Green had mentioned everyone has, or most people have utility bills. We are just not even trying. And then also, I mean, they have to have a child or a grandchild that will sign them up and navigate this. And just from my own experience, I know that just takes hours of trying to figure this out and navigate, you know, is it BJC, is it SMS? And that's with someone with time on their hands and also internet access and the know-how of calling around and trying to figure this out. And I know the mayor said last night on our call that the severely ill population is likely in touch with a doctor and can get on the list through their doctor. That's not been the case from my family's experience at all. I mean, it's just a complete roadblock. I know other counties, when you sign up, they have a checkoff and they get your best phone number in case you can be there in 30 to 45 minutes. So if they have extra vaccinations, then they can call a list of people who meet the criteria, not people just calling friends and family, not people from the county showing up, not people just off the streets, they can call the people who meet the requirement. I also, that there are going to be no shows. So I don't know if an additional percentage of people were invited to Saturday's event. And I don't understand why this is secretive. The state issued their locations yesterday for this weekend, and then additional locations today for, in fact, I just had it up on my phone. I lost it, but for, I think, next week. So I don't really understand what or why this is secretive. We have the National Guard. It just makes no sense to me. Again, why we can't do the drive-through makes no sense to me. And I've organized large-scale conferences before. I mean, Eventbrite could do a better job, or even hiring a consultant that specializes in handling these managing these types of lists or crowds, having some sort of system where you can at least scan in anything other than just mass emails on a Friday night for a Saturday morning, and not even considering our most vulnerable. So with that said, thank you very much for your time. And also thank you, Madam Chairwoman, for continuing with this hearing.
Thank you, Alderwoman Martin. Alderwoman Navarro, did you want to further go into additional questions or thoughts that you may have at this time?
No, thank you. I think I included all of them previously. Thank you.
And I lost my roll call here, excuse me. Alderwoman Middlebrook. Alderwoman Middlebrook, I know you were with us earlier. Are you still with us? Alderwoman Middlebrook had to jump off a little bit early. Alderwoman Rice.
Thank you, Madam Chairwoman. And I want to echo everyone's thanks for continuing to have this hearing, for continuing to push that this committee, this already established health committee that encompasses all of these issues that we have faced since the beginning of the COVID pandemic, continue to try to lead here. So thank you for that. Thank you for continuing to have this hearing this morning, because I think it is important for us to be able to gather as a committee and get some of these issues out in front. COVID has been, since last February, March, an all hands on deck situation. It should have been an all hands on deck situation. In this city, as an elected person in this city, it has not felt that way. It has not felt collaborative. It has not felt that our concerns for our constituents have been welcomed into the room, or the resources that our constituents bring as well. In communication, in crisis, clear communication, clear leadership is necessary. Building up trust with a one single communicator who is clear, who is able to be completely transparent, to offer answers, and to admit when we don't have the answers is vital. You have to build that trust in a community, especially in a time of crisis. And I've not seen that out of the administration. And I'm not trying to be, trying to just take shots here. It has been very frustrating from the perspective of an alderperson whose constituents look up to us for answers. And to say, I sit on the health committee and I have no answers for you. I try to be very honest with my constituents when I have no answers, and I try to get them when I don't have them. But when we are also not being given information, it is very difficult to do our jobs. And I think today's hearing and lack of attendance by the health director who had confirmed, nor anyone from the mayor's staff, reflects that. One of the things that I have raised, and I will continue to raise it and look for explanation for from the administration, is what type of information can be given to alderpersons when events like these are scheduled, right? We are the first points of contact in our in our wards for information. When people hear that something is happening with the city and have questions, they call us. We had no formal notification that any sort of vaccination was going on. So I was not aware, or I was not made aware in any formal capacity of the testing of city employees on Thursday and Friday, and let alone the public on Saturday. And I think even just giving us that information to say, here's what we're doing, here's who it affects, here's how to help communicate that to your constituents, here's what we need for help as well, right? To say, you know, hey, we have people who might need rides, we have people who might need someone to hold on to their children while they're walking through a line or something like that. We have resources available, and we all want to contribute to the solution. But without that information even getting to us, we can't do that. So that is one of the things. Constituents asking about children, constituents asking about accommodations once they got out of the car and had to go inside Union Station. It really for me comes down to the issues that I've heard from constituents come down to, if we are working to vaccinate our most vulnerable populations, how are we centering them? How it doesn't look like we are, right? So packing a bunch of unvaccinated people into a small conference room as they're moving through the line is dangerous if people already have complicating health conditions, right? If they don't feel safe even coming to our vaccination events, because we can't provide, we can't tell them whether we're going to provide wheelchairs, or they're going to have to wait in line outside to come in, outside in the rain before they're able to come in. How, you know, and again, echoing all of my colleagues' questions about, you know, we know the people who don't have access to the internet, right? Who aren't signed up. I've looked over the website again this morning just to verify that there's nothing there. And when you go to just the COVID-19 vaccination page, there's a wealth of information there about the tiers, about what category we're in, about the vaccines themselves. But there is no way to sign up for our list that is not online. There's no way besides the website that is listed on our COVID-19 vaccination page. There's not even a phone number to call, which we've been told that folks can call into the health department, and then the health department workers will add them to the list. But that information is not even on our own website. There is a text number, but that is for Nixle updates. That is not to add yourself to a list. So you can't even add yourself to a list via SMS. So trying to even like come down the steps of accessibility, we don't have them at the moment, and so we need to build that up. And I'm encouraged by Alderwoman Tyus saying that she is mailing out letters and building her own phone tree, but that's not, that type of leadership needs to be city down. We all have vulnerable populations that we need to address, and we could be doing this collaboratively. We could have a single form, if we're needed to mail them out, we can certainly do that. But if we all have a coordinated form of how we're asking the questions, making sure that we're protecting people's information, all of those things are important to do. So I will type these questions up as well and send them to you, Madam Chairwoman, so that we can get some answers on those. But I just wholeheartedly agree with Vice Chairwoman Navarro. Just we have seen in other cities that they have goals, they have a strategy, they have a written set of here's who we are going to address, here's how many people fall into those categories in our city. We have that data. We need to have measurable goals and report back on our progress on those goals. The city, like you said, Alderwoman Navarro, if we are going to come out of this on the better side, then we need to be addressing these things from the very beginning. And there is time to course correct and make sure that we are reaching our most vulnerable residents first. So thank you again, Madam Chairwoman, for this opportunity to try to ask some questions, but we will ask them in written form going forward. Thank you.
Thank you, Alderwoman Rice. I appreciate your concerns. Alderman Todd.
Okay, thank you, Madam Chairwoman and the Health Committee. Thank you so much for the racial, class, disability, and gender equity that everybody have expressed. I would just quickly go, you said most of the things that I was thinking. So people in the 18th Ward need education as to where the sites are located, especially in poor neighborhoods the elderly and disabled, and also the people who are homeless. They also, and those who uh, move from place to place, as well as lack of many of them lack technology. Some lack transportation and mask and hand sanitizers, and many would have concerns about not being able to social distance at the sites as they go in. So thank you very much. That's all I have.
Thank you, Alderman Todd. I noticed that we have several members of the Board of Aldermen who have joined us who are not on the committee, but are here today because the Health Committee does consider all matters pertaining to health, and so it would be natural to want to seek answers here. So I'd like to give those members of the Board of Aldermen an opportunity to log concerns or ask questions. Alderwoman Pam Boyd. Are you with us, Alderwoman Boyd? We can come back to you. Alderwoman Shamim Clark Hubbard.
Good morning. No questions. Thank you.
Alderman Gunther.
Thank you, Chairwoman Spencer. I think most of my sentiments have been well stated by the rest of this committee. So thank you for having this hearing, and I hope to see some of those answers from Dr. Echols and the mayor's office. Thank you.
Alderwoman Grass.
Good morning. Thank you for the, thanks for having me. I guess my question is, have we collectively as the Board of Aldermen or as this committee or any committee approached the mayor's office to work in conjunction with them to get anything out to the general public? I mean, are we doing press releases, or are we doing radio? Are we doing television? Or are we doing all that?
Well, Alderwoman Grass, this hearing today was an attempt to have those conversations with the administration and the Director of Health, both of whom were notified of this hearing and invited to come before us. You know, I'm dismayed that hasn't happened. I did receive notification from the Chief of Staff, Steve Conway, that he would be available for communication maybe later this week. So I fully intend to do that. We'll let the committee know when he may be available. I think that's a very valid question, and one that we should seek immediate answers to as soon as possible.
Yeah, let's, if we can, I mean, if we can be in the room, I think we will all be able to inform our constituents better.
Sure.
So I don't know. That's all. Thank you.
Thank you, Alderwoman Grass. And, you know, I will add that York question to our list of concerns and questions. I think really helping to organize that, recognizing that the administration and the health department does have a lot on its plate. So we'll do our best and our due diligence to organize those questions that we had hoped to present in a constructive manner before them directly. But obviously without that, coordinating that will be, I think, helpful.
Right.
Alderwoman Boyd, I saw you kind of pop in afterwards. Did you have a question, or did you want to share a concern? Okay. Hearing none, no other concerns from members outside of the committee. I think what I'd like to close us out, recognizing that, you know, several things that were mentioned here. I mean, I think we all know that our federal government, especially under the previous administration, has really failed Americans across the United States. We have a lack of real preparedness to test, trace, and now to vaccinate people. I am hopeful about the new administration, and as we move through this, attention to kind of righting a ship that has been going wrong. Our state has failed us. The big government entities in our lives have been failing us, but the city can do better. We need to do better. Cities across the nation are responding and picking up where those larger government entities are failing its citizens. And so when I see the number of participation here, the committee coming before, you know, to ask questions on behalf of those who put us in office, I'm hopeful. I'm hopeful that you all have taken such a thoughtful approach to this issue, hearing concerns, and logging them. This is an incredibly hopeful hearing from my perspective. And, you know, it is important to recognize that it is our duty, it is our responsibility as elected officials to address concerns of the general public, to hear them and to take action. We're the Board of Aldermen, where us as individuals do not have the authority to direct actions of the administration. It is our responsibility to ask those questions and get answers on behalf of our constituents. And that's precisely what we're doing today. Thank you all for taking the time to be here. And thank you for taking the time to put those questions in written form. I want to summarize some of the questions here before we go on to the rest of the agenda. I know we have a couple of housekeeping issues that we need to take over, but let's go ahead and finish this conversation first. You know, I'll log in addition to questions and concerns about the rollout, that we have people without access to internet, transportation issues, notification issues, communication with the general public, signing up outside of a typical online experience, and as Alderman Todd mentioned at the very end, our absolute most vulnerable, those who are unhoused and cannot participate in social distancing by way of living in the public right of way. I'll also add those folks that are serving the needs of our unhoused, tent mission, pot bangers, et cetera, those folks who interact with those communities on a daily, regular basis, who we need to prioritize outside of a typical set of priorities to make sure they get vaccinated or have access to that information on the front end. I appreciate your willingness here to coordinate these concerns in written form. If you all can get that to me by in the next few hours, I'd like to share that with the administration and Dr. Echols. I appreciate Alderwoman Navarro, your summary again, recognizing that this is incredibly difficult and there are going to be hiccups. I think we all should take a step back and recognize that, but it is our duty to build trust and have our movements through this centered in trust and equity. And building trust means having transparency. And that means answering questions and concerns of our constituents and those here on the committee and at the full Board of Aldermen. Okay, and with that, I think what we'll do, we can get those questions coordinated. I'd like to take care of a few housekeeping issues, which include approval of the minutes from January 12th. Those are in our Dropbox. I'll entertain a motion for the approval of minutes from Tuesday, January 12th.
So moved.
Is there a second on that?
Second.
Moved by Alderwoman Ingracia, seconded by Alderwoman Martin.
Before you, Madam Chair, there is just before you call the roll quick, there's a typo in there. It says the meeting was called to order at 11 p.m. and it should probably be 11 a.m. I just wanted to point that out. I see the clerk nodding his head. Yeah, thank you. That's all.
Thank you all.
An amendment or anything. I just wanted to make sure we caught that.
Sure, appreciate that. And with that, Mr. Clerk, would you please call the roll?
Alderwoman Ingracia,
Aye.
Alderwoman Tyus, Alderwoman Green, Alderwoman Martin. Thank you. Okay. Vice Chairwoman Navarro,
Aye.
Alderwoman Middlebrook, Alderwoman Rice,
Aye.
Alderman Todd,
Aye.
Chairwoman Spencer,
Aye.
Alderman Tyus, Green, Martin, Middlebrook, you have 5 aye votes.
Excellent. Thank you, Mr. Clerk. You know, and with that, I'd like to excuse Alderwoman Green with necessary absence. We have no bills for review, no resolutions. Our purpose here today was hearing concerns and sharing questions for the Director of Health and the administration here as we look at the vaccine rollout. We have accomplished that. And with that, I will entertain a motion to adjourn.
Move to adjourn.
Is there a second on the motion? Great. We are hearing no objections. We are adjourned. Thank you.
Thank you.